My name is Peter English. I've been a consultant in communicable disease control since 1998, with a particular interest in vaccines. So I became the editor of a Vaccines in Practice magazine, and I've been involved in vaccination for some time. And until last autumn, I was the chair of the BMA's Public Health Medicine Committee. Yes, I used to go to the European Society of Paediatric Infectious Disease conferences, the ESPID conferences, and I'd come back and talk about them. And several years in a row, we were hearing more information about this vaccine that was on the horizon and getting closer to prevent cervical cancer. And then I came back one year and it was coming on the market. And my then 14-year-old daughter asked me if she could have it. I didn't suggest to her that she should. It came from her. So I managed to organise her first dose privately. I actually gave it myself, and then she had then the program started, and she had the rest of the doses through the program. Okay, well, we know that at least 99% of cases of cervical cancer are caused by persistent human papilloma virus infection. I'm slightly anxious about the elimination bit because there's the up to 1% that aren't caused, as far as we know, by the HPV virus, but I'm not quite sure how they see those being eliminated. We have good tests. It's very easy these days with PCR tests to pick up tiny quantities of virus with a vaginal swab. Possibly even in due course just in a urine sample, but I think at the moment they're going for vaginal swabbing. So you can detect the virus in tiny quantities. Now, we know that at least prior to the vaccination program, most people would acquire the virus within a year or two after starting to have sex. That was just part of what happened to everybody. Of course, since vaccines come in, the ones that are most oncogenic, most likely to cause cancer, have been being prevented by the vaccine. But there are other strains that are less likely to cause cancer, but can still do so. It all has to do with how long the virus hangs around and doesn't get cleared. Most people, when infected with the virus, will clear it spontaneously. Their immune system will come to recognize it and clear it. But in some people, that doesn't happen, or it takes a long time. Not too surprising if you think about it. It's the same family of viruses as causes warts, the common warts you get on your hands or your skin, or when you get them on your feet, they're called verrucas. It's the same thing. And we know how long it can take for those to go away on their own. And what's happening there is it takes the immune system quite often a long time to learn to recognize that this is something foreign that it should be reacting to and do so. So if you have the virus sitting in your genital tract for a long time, years, it can start to cause the changes which start to cause the pre-cancer changes and then eventually cancer. So if you can identify the women who have this virus sitting in their genital tract and it doesn't go away, you can then offer them other sorts of screening to look to see if they have precancerous changes or cancer. We know that men who have sex with men are particularly prone to anal cancer, which is from the same strains as cause cervical cancer. In fact, a higher proportion of anal cancers are caused by the strains that cause cervical cancer, the strains in the vaccine. So the vaccine is likely to be extremely effective at preventing anal cancer in men. It can also cause anal cancers in women and penile cancers and other cancers of the genital tract, and indeed at the head and neck. You can get cancers in the mouth and the neck caused by exactly the same virus for the same sorts of reasons.